Hi, Patricia here from Rapid and Click. In today's video, we'll be talking about cardiovascular medications. Let's talk about this medication that works through the renin-angiotensin-aldosterone system pathway. So a little physiology on how these medications work. Now, anytime there is a decrease in renal perfusion, which is manifested by hypotension or a decrease in blood pressure, the kidney senses it and then release an enzyme called renin. Renin convert angiotensinogen, which is also released by the liver, into angiotensin 1. Angiotensin 1 is in an inactive form, so it's an inactive protein. Angiotensin 1 is then converted to angiotensin 2 by an angiotensin converting enzyme, which is released by the lungs. Angiotensin 2 has a number of functions that it performs. First, it causes vasoconstriction of blood vessel. Angiotensin 2 is also going to cause water and sodium to be reabsorbed into the kidneys. It also causes the release of aldosterone from the adrenal cortex, which also causes reabsorption of water and sodium by the kidneys. All these activities helps in increasing the blood pressure and are also the body's own mechanism of increasing blood pressure. So now let's take note that all these factors are the body's own mechanism in increasing the blood pressure. The medications I am about to mention works on different parts of the renin-angiotensin-aldosterone system. The first medication I'll be talking about is used to treat hypertension as a direct renin inhibitor. An example is aleskiren. So aleskiren is an antihypertensive used to treat hypertension, and it acts by inhibiting renin and prevent angiotensinogen from being converted or from being activated to angiotensin 1. That is the main mechanism of aleskiren. So some of the side effects that we should take note for our NCLEX exam is that this medication causes hypotension. It also causes angioedema. So for your nursing management, the key thing you have to do is that you have to monitor this patient's blood pressure consistently, and also you have to be watching out for signs of angioedema. So if the patient complains of heaviness in the tongue, it's a sign of angioedema. Our next medication that works through the angiotensin pathway is the angiotensin converting enzyme inhibitor, or the ACE inhibitors. So an example, we have lisinopril, captopril. So all medications ending with the prils. They are medications used in treatments of hypertension, heart failure, myocardial infarction. And these medications work by blocking the conversion of angiotensin 1 to angiotensin 2. Some side effects of angiotensin converting enzymes include hypotension. It also causes angioedema. And then one side effect that patients mostly come with is the cough. It can also result in elevated potassium level. And one important thing you should take note of is that this medication is teratogenic and that it should not be given in pregnancy. So for your nursing management, always monitor the patient's blood pressure. You should also educate the patient to rise slowly or change position slowly due to the medication side effect of causing orthostatic hypotension. And then also one side effect, like I stated, it causes angioedema. So always be watching out for such signs. When the patient complains of heaviness in the tongue, it's a sign of angioedema, and that you should report it and stop the medication immediately. Another class of drug that works on the angiotensin-aldosterone system pathway is the ARBs, or angiotensin receptor blockers. An example is losartan or valsartan. So these medications are used in treatment of hypertension, and they work by blocking the effect of angiotensin 2, resulting in vasodilation. Any medication that causes vasodilation, we know that our blood pressure is going to reduce. Some side effects of angiotensin receptor blockers are hypotension, dizziness, and GI upset. This medication is also to be avoided in pregnancy because it can cause fetal toxicity. And so for your nursing management, always monitor the patient's blood pressure and educate the patient to change position slowly, as they can result in orthostatic hypotension. The last medication along the pathway for renin-angiotensin-aldosterone system is the aldosterone antagonist. An example is the eplerenone. So this medication is used for treatment of hypertension and heart failure, and it works by blocking mineralocorticoid receptors, which inhibit the effect of aldosterone and inhibit sodium and water reabsorption. So some side effects include hyperkalemia. It can also cause dizziness. So for your NCLEX exam, any patient on eplerenone, always remember to check their potassium levels. All right. Thank you and see you in our next video.